Hello, everybody. Welcome to Let's Talk, a series from Gift of Life, Michigan that explores the stories of people whose lives are changed by organ and tissue donation. We answer your questions about donation and help you find ways to learn more and to get more involved. We have a great show today to discuss the HOPE Act, which, if passed, would allow HIV-positive organ donors to give to HIV-positive recipients. We are going to speak with the bill's sponsor in just a little bit. Hello, Representative Felicia Brabec. How are you?
Good morning. Thank you. I'm so excited for us to be able to talk about this and the incredible impact that it will have on Michiganders. It's fantastic.
I can't wait to talk with you about it. We also have some other guests a little later in the program. This is Pride Month, so we're going to speak with Dave Garcia, Executive Director of Affirmations, Michigan's largest LGBTQ community center located in Ferndale. We're going to speak with him in a little bit. Hi, Dave.
Hi, how are you all?
And we've got Bishetta Brown from Wellness Aid Services based in Flint. We're going to speak with her about organ health and AIDS health and HIV. And we have a personal story about donation from Londel Cook, and we're gonna wrap up with him. So we've got a great lineup today. Thank you all for joining us. If you are watching us live, like and share. Let us know that you're here and watching. Ask your questions. Put your comments in the comment section. We're here to answer your questions. If you're watching the show recorded, please share and comment on Facebook. So thank you all for joining us. I see we've got Bruce Nicely, our Chief Clinical Officer. He's watching. So thanks, Bruce, for being with us today. Representative, you represent Michigan's 55th district. Gift of Life Michigan is based in Ann Arbor. It's your home turf. Thank you so much for sponsoring this important legislation. Tell us about what interested you most in about sponsoring the HOPE Act.
Sure. So one of the really exciting things is that the person who preceded me, Representative Rebecca Warren, she kind of got the ball rolling during the last term. And then unfortunately, the session ended and she was able to get the bill out of health policy, but then the term ended. And so she and I were talking about some of her bills that didn't have enough time, and this was one of them. And I was so incredibly excited, not only because of being able to add to our organ donor pool and how important that is. I mean, I'm an organ donor, have been for years and years, and I just want to encourage more people to do that. But if we had another way to be able to do that here in our state, instead of sending organs to other states to be used, like, why wouldn't we want to help other Michiganders? This just seemed like a no-brainer to me. The other thing that was also just really personally important to me is that when I was a very, very young, actually a student in social work school, so in grad school as a social worker, my friend and I volunteered every week at AIDS Action in Boston.
Did you really?
We did. And so, we loved it, and we got to do outreach and needle cleaning kits. I mean, all sorts of fantastic things. And so when I saw this, it brought me back to my roots and a way that we could advocate and help. And obviously we've come a long way since, the mid 90s, which is wonderful. Thank goodness. I just felt like kind of coming full circle in this being able to help move this. And so I'm so excited that for the work that was done before, obviously being able to work with you, Patrick, and all of our supporters, whether that's individual organ donors or organ recipients or our transplant teams. I've talked with different doctors who have said, thank you so much. How can I help? And so everyone is really rowing in the same direction on this, which is fantastic.
I was so gratified and astonished to see unanimous support out of the committee. And then tell us about the House vote.
I know, it gives me goosebumps. So the bill, when I first dropped the bill, it got bipartisan support for sponsors, which I was really excited about.
That doesn't happen very often in this community, does it?
No. So I was really excited about that. And then, we got to move. I worked with the chair of health policy, and she was very receptive. Representative Colley was very receptive. And then the committee was very receptive as well when we testified, and then subsequent conversations with the committee. And then it came to the House floor. And I could have never envisioned, I thought, well, maybe there'll be one or two no's, on this amazing bill. But the screen was all green. So
Incredible.
all 110 representatives voted in favor of this bill, which is remarkable.
Unanimous support out of the House of Representatives.
Yep.
So now it heads to the Senate.
Yep.
Is that right?
That you got
Tell
it.
us about where we're at in that process and what you expect.
So where I was even checking today, I'm like, did we get a committee yet? Do we know yet? So the bill will go over to the Senate. We don't know which committee yet. It'll be assigned a committee. And once it's assigned a committee, we'll do the same process that we did in the House over in the Senate. So I will be having conversations with the chair, with the members, obviously much smaller number. There are only 38 senators, so much smaller number of folks. And then we'll do the advocacy of hopefully getting it out of whatever committee, and then advocating for it to have a vote on the Senate floor. And so those are going to be the next steps for us.
I really enjoyed talking with all of our state representatives. I talked with every member of the committee as well. I know you were pushing behind the scenes like nobody's business, which we really appreciate. No, the transplant centers, there are 9 transplant centers in the state of Michigan. They're all behind this bill. And we're going to talk with Dave in a little bit about community support. But one of the things that I think was such an important point that seemed to move everybody to make this a no-brainer is that Gift of Life Michigan does recover organs from HIV positive patients currently, donors currently. But because of the law, we have to send those life-saving organs out of the state of Michigan.
That's right.
Everybody who hears that, they're like, well, we have to stop that right now. Why are we not enabling people who are HIV positive here in the state of Michigan to benefit from those life-saving organs? And it ends up creating the other people who are on the organ donor waiting list. It frees up those organs for those people. And it just seems to make so much sense for people. It was wonderful that people weren't opposed. It doesn't even matter. So many different religions support organ and tissue donation. And this issue is one of those. We were even getting the Michigan Catholic Conference to be supportive of this. So we have this wide breadth of support. So what is it going to take for this not to get stalled in the Senate and for this to actually get passed? There's lots of important things going before the legislature. And how do we make sure that this happens?
So it's a vital question to ask, Patrick. I'm so glad you did. I talked earlier about all of us rowing together, to get this through the House. The same thing is going to need to happen, right? So from all of our different roles, we're going to need to be able to talk with and finding out what committee it's in. We're going to need to really talk with and advocate from our different perspectives in terms of the importance of this bill for Michiganders. And I think that if we do that, if I have those phone calls or those conversations, you have those conversations, residents out there are calling senators, letting them know about this, letting them know the importance of it and how they want to see a vote on the floor. All of that matters. All that advocacy matters. And so those important phone calls, those emails that come in, they all matter.
Thank you so much, Representative. Well, with that, we're going to bring in Dave Garcia to the conversation. Dave, thank you so much for joining us.
Absolutely. Thank you. And thank you, Representative, for all your work.
So, Dave, you have a lot of experience in being a community advocate for advocating for issues that are not just for people who are HIV positive, but for gay and lesbian issues, not just in the state of Michigan, but prior you were out in California and you worked on helping get legislation similar to this passed in California.
Yeah, we did. Actually, my policy team at the Los Angeles LGBTQ Center took this on in coalition with AIDS Partnership Los Angeles and Equality California and the Positive Women's Network. And we worked together to get this pushed through. It was actually fast-tracked. It was urgency legislation also passed unanimously in the state of California. That was back in May of 2016. So, yeah, I've been to this rodeo before. This should not be a partisan issue, and it should be passed unanimously and quickly. We're talking about hundreds and hundreds of transplants and saving the lives of hundreds of people.
That's right, Dave. Tell us a little bit about Affirmations and your role there and some of the things that you're doing, not just this month, which is Pride Month, but just in general at Affirmations.
Sure. It is Pride Month. This is my second time back at Affirmations as their executive director. Things are going well. It's been very busy. We have all kinds of service. I don't want to get into everything we do, but we have mental health care and recovery groups and coming out groups and trans groups and senior groups and a lot of support groups for our community. We do a lot of arts and culture events at Affirmations. Affirmations is Michigan's largest LGBTQ community center. We've been around for over 30 years. So, we have our hands in a little bit of everything, including public policy, of course, which this fits squarely in.
You had talked with some of your other partners who, some of the other community centers, and they're all backing this and thank you for garnering all of that support, and thank you for being with us this morning, Dave.
Thank you, Patrick. Yeah, and you're right. All 10 community centers across the state of Michigan have expressed interest in backing this legislation.
But you guys are the largest.
We are. I'm fortunate to sit on the board of directors of Centerlink, which is the national LGBTQ community centers network of about 250 centers across the country. And when I came back from Los Angeles, I wanted to kind of duplicate that. And so we worked together to coordinate the 10 centers across the state of Michigan, to work together, to learn from one another, to get through COVID together. Many different positive reasons why we should be meeting regularly. And we do every other month. And many times we talk about policy issues that all 10 of us together can have much more of an impact on than any one particular center, even Affirmations as the largest.
Great. Thanks so much, Dave. And thanks for your support of this bill and for all of your advocacy and for marshaling the community support. We're definitely going to need it as we move into this next phase.
Anything we can do to help.
So learning just a little bit more about some of the programs and the health issues related to those who are HIV positive, we wanted to bring in the perspective of Bishetta Brown, who is from Wellness AIDS Services in Flint. Welcome, Bishetta.
Hello, thank you for having me. How are you all doing?
Doing well, doing well. So tell us about Wellness AIDS Services in Flint and your work there.
Okay. Wellness Aid Services, we've been in service for over 30 years. It's a community-based services for those living with a risk of HIV in the Genesee County, Siwash, Lapeer, Saginaw, Tuscola, and Livingston County. We offer several programs in our housing. At Wellness Services, we have HIV testing and education, care coordination, medical case management services, which we offer behavioral health services, tobacco services, reduction services, case management services for clients. We have a syringe exchange program that we offer at Wellness. We also have the naloxone education distribution program, community education workshop, the LGBTQ plus Safe Ally Center, and we also do Flint Pride in the park.
Fantastic. I am just so impressed with the scope of what you all do. Flint and Genesee County, it's my old stomping ground. So before the show started, we were talking about our Genesee County days, and I know Dave Garcia is a Genesee County boy too. So it's all home school week here.
Yes.
Tell us a little bit, how does HIV and AIDS affect organ health? And what are you seeing and how this is affecting people's lives and the need, especially when it comes to kidneys?
Okay. The way that we have noticed over the years that it has affected the organs, you have to look at the history of the clients themselves. So if you have clients that have been on a medication for quite some time over the years, as the years goes, it also has an effect to the organ. Mm-hmm. And kidney will be one of those things that it can affect also too. But with a lot of these newer medication the risk is it's a little bit lower. That kind of affected the kidneys, I would say, and some of the organs. It kind of help it out some with that over time. So it just the individuals, each person, it affects them individually. The way how that works.
One of the things that we think is important to, as a part of this bill, is organ and tissue donation is a rare thing in general.
Yes.
There's only about 1% of the deaths that happen are even possible for organ and tissue donation. And then from that, you take an even smaller number of people who are HIV positive.
Mm-hmm.
But for those people who are benefiting from that one donor can save up to 8 people's lives.
Yes, it
And
can. Yes.
improve the lives. One tissue donor can improve the lives of up to 75 more. The HOPE Act allows for organ donation, not tissue donation, organ donation. And so to those 8 people, potentially, it's not a small number. It's a matter of life and death. This is what we're seeing: people on dialysis, people who are in kidneys are the most common need. And so how is it that you support people on the health side of things? It's education, I'm sure, about their health, but you also promote people to add their name to the organ donor registry, I presume. And that's one of the misconceptions out there that we really want to debunk. If you are any walk of life, HIV positive, add your name to the organ donor registry. People have that misconception that you can't be an organ donor, and you can.
Right.
Yes.
Well, what other sort of things, Bishetta, do you have as far as programming and that sort of thing to support people who are HIV positive and on the educational front?
Some of the programs that we have, like I mentioned, we have like the syringe exchange, the naloxone program. Like the syringe exchange, that program is Mondays and Wednesday, where the public can access that at our office at 311 East Court Street in Flint, Michigan. And they can access that to get a syringe exchange for that. And we have the naloxone education distribution also too, on those particular days also too.
Thank you so much, Bishetta. This has been very informative. Now we're going to bring on the call someone who is, a kidney recipient. We've got Londel Cook here. I look forward to hearing from. Welcome, Londel. How are you?
I'm good. How are you?
Good. Thank you so much for joining us this morning. Tell us a little bit about your story. You are a kidney recipient.
Yes.
Tell us a little bit about what happened.
Well, I am a kidney recipient. I received a kidney in 2019, March 28th of 2019. I had been on dialysis for 12 years. During that time, I had undergone several surgeries, a couple surgeries that didn't go well, several reports, and the process of going through to have dialysis. Well, I wasn't initially able to be listed because I had some compliancy issues. Being on dialysis so young, all of my 20s, I was sick. You really, to go from being healthy to not, it's difficult to tell yourself that this is something I have to do. So with me used to working all the time, being on my own, it was a very difficult transition for me. So in the beginning, I wasn't really compliant in the beginning. So I wasn't able to be listed for a while. And what happened was in 2019, I have a friend, she's like an aunt to me. We go to the same church. We've known each other for about maybe 15 years. Her brother suddenly got sick with bacterial meningitis that he had contracted from his workplace. After doing that, it was only about a week and he had passed away. He was perfectly healthy, getting ready to be married actually. And she said that she was in the hospital with him and they wanted to donate some organs. And she said that she felt led tell them, well, I know someone who needs a kidney. Let's see what happens. So they went ahead and worked the paperwork up, kept him on life support until they were able to test me and everything. Miraculously, he was a perfect match to me. I was not listed at that time. They went through the process, listed me, pushed it through immediately, almost overnight, and I was transplanted the next day.
Wow.
Wow, my gosh. How did that feel? You went from on pins and needles to knowing that it was going to happen. How did that feel?
There is no vocabulary, to actually put to being bound to a certain system for 12 years of your life, all of your 20s, into within 48 hours it no longer being your reality. I think that for me, the one thing that I can kind of say was that I was really grateful to God and grateful to that family for considering that for me. They didn't know me. The only person who knew was his sister, which was the one who suggested it. And because she felt strongly about it, they went ahead and went with it because of her. I'm actually very active in my community, so I had already written 2 books, and I sing and preach and stuff everywhere. So I was pretty active. So they felt that it would be a great use for their brother, her brother and his children felt that it'd be a great use for their father to live on through my life.
Thank you, Londel. There's 2 ways to be an organ donor. There's a living donor, where someone gives one of their 2 kidneys to someone, but for heart and some of these other organs, it has to happen, unfortunately, and the tragedy of someone's death. And in someone's saddest moment, that family or the person has decided to give that ultimate gift of life for someone else. So what message do you want people to know about how important being a donor is?
I would definitely want to let the people know that it's very important to see that person, that the loved one that you have, even though it's difficult to see them passing away, to kind of look at it from a different point of view, that this person is living on through the lives of someone else. And to know that if it was them in a reverse situation, how would they feel? I think that for me, I had to look at it that way because I really didn't think about organ transplant until it was time for me to have one. And it's really not something that a person thinks about. Normally, you're not thinking about the dynamics of it and how life changes and how it's night and day between needing an organ and not having one and needing it and then finally getting it. You don't realize it until you're actually in that situation. So I would definitely give them a message from my point of view to say that, if it was in your situation with me, it was different for me. It opened my eyes up to understand this is definitely an essential part of what we do as mankind to, keep the circle of life moving forward.
That's right. There's over 100,000 people nationally waiting for a life-saving organ. You were one of the lucky ones, but sadly, 20 to 30 people die each day in our country waiting for a life-saving organ. And the only way for that to be rectified, for those people to be saved, is for people to add their name to the organ donor registry. And you can do that by going to Gift of Life's website, golm.org. You can also sign up when you renew your driver's license at the Secretary of State. Get that little heart on your driver's license. So thank you so much, Londel, for being with us and for sharing your story. Rep Brabec, one final pitch. What do we have to do? We have to call our senator, right?
Please call your senators, call the other senators, call everyone to make sure that they vote affirmatively for this. We want to be able to have more happy endings like Londel's, right? Like we want to be able to, and if we can do something, we should be. And so I just plead with folks who are watching and who will watch to help us do that advocacy.
Fantastic. Thanks. So don't forget to do that. Happy Pride Month. Dave, I know you've got lots of activities. Thank you for being with us. And Bishetta, you do such inspirational work. Thank you for all you're doing. Thank you, all of you, for being with us today. You can learn more about being an organ donor at Gift of Life Michigan's website, golm.org. Tune in for our other programs. Later in the week, we've got 2 more shows. Thursday afternoon, The Blink will feature kidney transplant recipient Deja Foster. And Friday at 1 p.m. is our self-care series special on healing and the power of art. Everybody, thanks. Have a good day.
You too.
Thank you.